Perform passive range of motion to the elbow and wrist. Introduction. Range of motion exercises are only done with a doctor's order. They are performed to keep a patient from losing function while they recover. They are only done on the extremity indicated in the care plan. CNAs are not performing exercises to restore function, only to keep the patient from losing function. You will examine the patient throughout the skill for signs of pain. If the patient has pain, you will only progress with the exercise to the extent that the patient is comfortable. Ask the patient frequently about pain. Every exercise will be performed 3 times. You will always return the extremity to the starting position before continuing with the next repetition. Make sure you are performing a full range of motion up to the point of pain and moving the extremity slowly and smoothly, supporting it fully. The care plan will tell you what arm to perform exercises on. Because this is done only with a doctor's order, it is critical that you perform the exercises on the correct extremity. Performing these exercises on an arm that has just had surgery or has a medical issue like a blood clot can cause serious injury. The care plan will indicate if the exercises are to be performed on the patient's right or left arm. The patient's right and left are different from yours. Pay attention to choosing the correct extremity. Explain to the patient in plain language what you are going to be doing. This helps them understand what motions you will be performing and helps gain their trust and cooperation. When performing range of motion to the wrist, the following motions will be performed 3 times each. You can remember this easily by remembering the initials USA. U stands for up-down, which is a flexion-extension motion. S stands for side-to-side, or an abduction-adduction motion. And A stands for around, which is a rotation motion. Not all joints in the arm can move in multiple directions. The wrist will perform all 3 motions, but the elbow will only go up-down. When performing range of motion exercises on the elbow, only one exercise needs to be performed, a flexion-extension motion, or an up-down motion. You will move the lower arm toward the upper arm, as if the patient were making a muscle. This will be repeated 3 times. The elbow is a hinge joint and only moves in one direction, therefore only has one exercise to do. You will now move on to the wrist. The first exercise the wrist will perform is a flexion-extension motion, or an up-down motion. You'll close the patient's hand into a fist and bend the fist forward and backward, as if the patient is revving a motorcycle. This will be repeated 3 times. The second motion of the wrist is an abduction-adduction motion, or a side-to-side motion. This looks like the patient is performing a beauty pageant wave. The palm of the hand is turned from side to side while holding the wrist stationary. This will be repeated 3 times. The final exercise to be performed on the wrist is a rotation or around motion. The hand is moved in a circular motion like a person holding a magic wand. This will be repeated 3 times. A recap of all 3 wrist exercises includes an up-down motion that appears as if the patient is revving a motorcycle, a side-to-side motion that looks like a pageant wave, and an around motion, which resembles a patient waving a magic wand. Each exercise is performed 3 times. After all exercises have been performed on the elbow and wrist, you will perform your closing. Give the patient their call light, open the privacy curtain, ask if they need anything else, and make sure they are comfortable. Wash your hands and review the steps of your skill. And finally, tell the evaluator your skill is complete. Watch the instructional video for step-by-step instructions on how this skill is performed. Then try this skill on your own.